Good afternoon, everyone. This is Batul from IGCP, the moderator for today's session, and I would like to thank everyone wholeheartedly who have joined our platform for the better exchange of knowledge that is going to be shared by our stalwart who is present here with us today. He's a very renowned venerologist, and he's none other than Dr. S. Murugan, sir. Sir is former professor in Department of Dermatology and Venerology at Sri Mukambalika Institute of Medical Science, Kulashekram, Kanyakumari District, Tamil Nadu. Sir is presently a senior consultant in HIV and sexual medicine at Trinuveli, Tamil Nadu, and former national president at the Indian Association for the Study of Sexuality Transmitted Disease and AIDS. The topic for today's discussion is female genital mutilation, physical abuse against female children. And to talk about this topic, we have him with us. Before moving on to today's session, let us have a brief look on what the topic is about. So, in this crucial webinar, the discussion is going to be on the harrowing topic of female genital mutilation, a deeply ingrained practice that poses severe physical and psychological harm to female children worldwide. This webinar aims to shed light on the prevalence, consequences, and efforts to eradicate this form of gender-based violence. Now, without any further delay, I would like to welcome him at our forum and would like to hand over the session to him for his precious talk to begin. So, over to you.
Good afternoon, everybody. Thank you, Batul, for the nice introduction. And thanks, IGCP, for giving me this opportunity to share the important topic with you all in this present afternoon. Today's topic is female genital mutilation, so physical abuse against female children. Many of you not have heard, not have come across something new, which is not common in our country. Then you may wonder why I have chosen this topic. As a global human, we have to know what is happening in the other part of the globe. So it's not a simple thing. It's going on for years. And in this era of migration, traffic increase, and every medical professional people, it's not surprised to come across such a case of female genital mutilation in their practice at any time. Then we should not be surprised or astonished. We must be familiar. So that is the idea of presenting this topic. And today's this is February. So the month of February, this is International Zero Tolerance Female Genital Mutilation. And I stand against female genital mutilation. Stop female genital mutilation. It's the oath we have to take, every one of us. The scope of learning is what is female genital mutilation? One more thing is interesting thing, unheard breast tithing, epidemiology, beliefs about female genital mutilation, various types of female genital mutilation, complications of female genital mutilation, and implications of the law. Female genital mutilation comprises of all procedures that involve partial or removal or total removal of or destruction of the female genitals, female genital organs for non-medical reasons. FGM is recognized internationally as violation against the human rights of girls and women. The removal of total or partial healthy normal genital tissue interface with the natural functioning of the body causes several immediate and long-term complications. See this agony of this child. The practice of female genital mutilation has no health benefits at all, causes severe pain, severe immediate and long-term consequences. It is mostly carried out by traditional providers who often play a central role like attending childbirth. It is painful, harmful, and traumatic. According to WHO estimation, nearly 100 to 150 140 million women and girls have experience across the world are living with this menace, and 92 million alone in Africa. The practice is carried out by some communities who believe it reduces the women's libido. FGM is a social convention, social pressure to conform to what others do, and have been doing it so strongly motivation of perpetuate and practice. They want to live with the society and the society pressure, social pressure. So they want to go with others. FGM is often considered as necessary part of raising the girl properly and a way to prepare her for adulthood and marriage. That is the thing. They believe it's a way to prepare her for adulthood marriage. FGM is often motivated by beliefs, what is considered as proper sexual behavior, linking procedures to the premarital virginity and marital fidelity. They are ensuring the groom about her premarital virginity and marital fidelity. So this is the way. And FGM is in many countries believed it reduces the women's libido, and they thereby that women can resist the illicit sexual acts when the vagina opening covered or narrowed. The fear of pain of opening it, or fear that is they will found out, is expected to lead further discourage the illicit sexual intercourse among the women. One Shariat law defines as only wars need a clitoris. Long back, 200 BC, it was demonstrated that female circumcision has been demonstrated among the mummies of Egyptian mummies, and FGM is mostly carried out by young girls less than 15. As I told already, 130 billion girls are across the world are living with that menace, and Africa alone 92 million. FGM is a violation against human rights against girls and women. Sorry, it's going. And it has been done, they believe it's a good tradition. It's a religious requirement, some people. And they believe it is cleanliness, ensures cleanliness, preservation of virginity, better marriage prospects, enhancement of the male sexual pleasure, prevention of promiscuity and adultery. So these are the beliefs on the basis of which this FGM is being executed. FGM is associated with cultural ideals of femininity and modesty, which include the notion that girls are clean and beautiful after removal of the body parts considered as male or unclean. Though no religious scripts prescribe practice, they believe the practice has religious support. Religious leaders, some people with regards to FGM, some promote it, some consider it irrelevant, some contribute its elimination. So there is no verse in Quran. In the most societies, FGM is considered as cultural tradition rather than religious, which is often used as an argument for its continuation. Violation of sexual child rights. So communities practice female genital mutilation, report a variety of social and religious reasons, forms the human rights perspective. It is mainly against the children, female children. So it's a violation of the rights of the child. 94% of the women in Egypt arrange for their daughters undergo medicalized female genital mutilation. 76% in Yemen, 65% in Mauritania, 48% in Ivory Coast, 46% in Kenya. That is medicalized done by physicians or doctor surgeons. This approach may reduce the immediate consequences of the procedure and pain to an extent, but the WHO and UNICEF point out it tends to obscure its human rights perspective could hinder the development of long-term solutions for ending the practice. Who estimates that between 100 to 150, so this is same thing. I repeat, I don't want to repeat. So especially the Western Africa and Eastern Africa or Northeastern or Northwestern Africa, the practice is abundant rather than another area. There is also there. And different countries, different percentage are following. And font marked as red all the countries where it is more than 70% are practicing. 70% women are being subjected to this FGM. So these are the important statistics. So the different types are there. Type 1, type 2, type 3, female genital mutilation has there, which is practicing among 28 countries in Africa and few countries in Asia and Middle East. Some forms of genital mutilation have also been reported in the migration population of the Central and South America. Growing up migration has increased the number of girls and women living outside their country of origin who have undergone female genital mutilation or who may be at the risk of being subjected to the practice. In India also it's being practiced in small community, almost 1 million population they are practicing. They are called as Dawoodi Bohra, a sect of Shia Islam, which is around 1 million members are in India. Some people in Karachi also they are practicing this. Government of India has banned this practice 2017 officially. The beliefs that clitoral head is unwanted skin and that is source of sin. They will make them stray out of their marriages or the reasons that lie the heart of the practice. And it is also called as katna or cuff or cuff. We have to know different types of FGM. It's not only female circumcision. Type 1, partial or total removal of the clitoris along with the prepuce. Type 2, removal of the clitoris hood along with labia minora with or without labia majora. Type 3, total destruction, infibulation, narrowing of the vaginal orifice, total closure, leaving a small hole for urination and the menstrual fluid flow. Excision of clitoris, labia majora, so total. So in the type A is removal of the apposition, removal and apposition of the labia minora. Type 3B is removal and apposition of the labia majora. And there is one more thing is called type 4, any type of penetration, pricking, piercing, and incising, scraping, cauterization, all without any medical reason, considered as FGM. Under subclassification, type 1, 1A, that is female circumcision alone. 1B, along with clitoridectomy. Type 2, it will be clitoridectomy with removal of the inner labia or outer labia. Type 2A, inner labia, type 2B, outer labia, or sometimes. And type 2C, both inner labia and outer labia along with the clitoris. So these are the different types. In type 3, there is a most crude method done by the elderly woman. Relatives and friends secure the girl in a lithotomy position. A deep incision is made rapidly on either side of the root of the clitoris up to the fossa, and a single cut of the razor excises the clitoris, both labia majora, minora. Bleeding is profuse, but is usually controlled with application of various types of poultice and a threading of the edges of the skin with the thorns or clasping with the split can to arrest the bleeding. And a piece of twig will be inserted into the edges of the skin to ensure a pattern foramen for urination menstrual flow. The lower limbs are bound tight together 2 to 6 weeks stable to promote hemostasis and encourage the healing. Healing takes place by primary intention. As a result of the intractus is obliterated by a drum of skin extending across the orifice except a small hole. The circumstances at the time may vary. The girl may struggle ferociously. In that case, the incision may be haphazard. The girl may be pinned down so firmly. Sometimes fracture of bone also happened in this procedure. See, after the surgery, the girl was tied for 6 to 8 weeks in this position. And it is very difficult to pass urine. Hell like that after surgery. Imagine. And sometimes it is done in mass scale. So this type of mass scale will promote infections also, about which I will tell later. See, these are the types of instruments they are using. Ordinary kitchen knives or things. The vulva is cut open for sexual intercourse after childbirth in future after this procedure. The penetration of the bride's infibulation takes place anywhere from 3 or 4 days to several months after marriage. Some men are unable to penetrate their wives at all, over 15%, and the task is often accomplished by midwife under conditions of great secret, since they reflects negative man's potency. Some of who are unable to penetrate their wives manage to get them pregnant in spite of infibulation by making the semen into the hole with some syringe or something. The woman's vaginal passage is then cut open to allow birth to take place. A great deal of marital anal intercourse also happens because of these reasons, which is not talked properly. So this will lead to all sorts of HIV, STI infections. So the men who do manage to penetrate their wives do so often or perhaps always with the help of a little knife. This creates a tear which they gradually rip more and more until opening and sufficient to admit the penis. In some women, the scar tissue is so hardened, keloid formation, and sometimes what happens, it may broke the scalpel, the keloid. So these are the things they have, we cannot imagine. FGM is carried out by traditional practitioners without anesthesia using unsterile cutting devices such as knives, razors, scissors, cut glass, sharpened rocks, fingernails, and applying suturing materials such as agave, acacia, thorns. The procedure is extremely painful, bleeding, complication, and complications like urinary retention, urinary infection, wound infection, septicemia, tetanus, and it may end in hepatitis, HIV infection, especially when it's done in the mass scale, and they are not knowing to how to clean the instruments, same instrument used for repeatedly. See the instruments used, and see this is a massive bleeding. Many girls will lose their lives in this procedure, sometimes due to tetanus, time to shock, or sometimes even during childbirth. All these things are very common. Immediate complications: shock, hemorrhage, pain, tetanus, sepsis, bacterial infection, urinary retention, open sores for long time, chronic ulcers. Long-term consequences include recurrent bladder and urinary tract infection, cyst, infertility, the increased risk of childbirth complications for newborn and the mother, and the need for lateral surgeries, repeated surgeries, opening, closing, For example, FGM procedures that seals a narrow vaginal opening, type 3, needs to be cut open to later to allow the sexual intercourse and also for childbirth. Sometimes it stitched again several times, including after childbirth. Hence, the woman goes through repeated opening, close procedure, further increasing repeated, and both immediate and long-term risks are more. Consequences to the child born: babies born to women who have undergone female genital mutilation suffer a higher rate of neonatal death compared to the babies born to the women normal. And low birth weight, serious infection among the baby, or perinatal death also can happen. Other complications include cheilitis, incontinence of the urine, genital, that is include vaginal pelvic infections, dysmenorrhea, dyspareunia, infertility, hematocolpus, hematometra, epidermoid cyst, all things can happen. Repeated pelvic pain and other problems. FGM may complicate the pregnancy and place the woman in a higher risk for obstetric problem, vesicovaginal fistula, rectovaginal fistula, holes that allows the urine and feces to seep to the vagina, preeclamptic toxemia, and labor cannot be monitored properly because the obstetrician cannot introduce a finger. So that's also labor prolonged, third-degree laceration, sphincter damage, emergency cesarean, neonatal mortality, all things are so common. And sexual problems, of course, sexual dysfunction. She will not be interested in sex at all. Dyspareunia. But several researchers have their interest in sex is not reduced. Desire for sex is not reduced. Women may request reinfibulation, restoration of the reinfibulation after giving birth. Other problems day-to-day life, problems of going to bathroom. In severe case, women are left with only small opening for urinating and menstrual bleeding. They have to spend a lot of time in the toilet, painful strain, and not being able to have sex normally. Every time is a painful thing. Problems of the gynecological health. So these are the things. They cannot undergo pap test, pelvic examination. These problems of FGM is related to cesarean section, postpartum hemorrhage, episiotomy, extended hospital stays, the need for infant resuscitation. While about 5% of the babies born to women FGM were stillborn or died shortly after delivery, this figure increases 6.4% babies born to women with FGM. Some may not understand what is happening to her at all. Psychological effects and this painful experience, we cannot imagine, we cannot describe. So increased risk of sexually transmitted infection, HIV, hepatitis, because of mass scale, repeated use of unsterile instruments, tetanus, people who have medical training, no medical training, under unclean conditions perform the FGM. Many times one tool is used for several procedures. So we need not describe much. Let us stop female circumcision. It is dangerous to women's health. The boards are kept everywhere in places like these countries. Everywhere, the laws also there. Possible adverse effect of the legislation is, as often occurs with abortion, or its tendency to drive FGM underground. They will not reveal. They will hide themselves, not come to the hospital at all, or death occurs, and encourage a cross-border movement of women from a country where the practice is illegal to a neighboring country where it is allowed. So these are all things can happen. And WHO is seriously concerned about the healthcare providers performing FGM. medicalization of FGM is also not acceptable. More than 80% of the girls, women are undergone FGM have had procedure performed on them by healthcare providers, but it also should be banned. The next one is, even though it's not so common, we have to know something about that, breast tanning or breast flattening. The breast tanning affects 3.8 million, that is 130 million, but it is only 3.8 million women around the world has been identified as one of the 5 underreported crimes relating to gender-based violence. The practice is commonly performed by family members themselves, 58% of the time by the mother. Estimates range from 25 to 50% of the girls in Cameroon are affected by the breast tanning, affecting up to 3.8 million across Africa. Similarly, female genital mutilation, breast tanning is also classified as physical abuse. Breast tanning is also known as breast flattening. It's a process where the young pubes and girls' breasts are ironed, massaged, or pounded down through the use of hot or heated objects in order for the breast to disappear or delay development of the breast entirely. It is believed that they are carrying out by this act, the young girls will be protected from harassment, rape, abduction, early forced marriage. So therefore, they can continue their education. They can finish their education completely. Otherwise, they will get married even or sometimes abused. Much like female genital mutilation, breast tanning is a harmful cultural practice and is child abuse. Professionals working in the children and young people must be able to identify the signs and symptoms of the girls who are at the risk of or undergone breast tanning. The mutilation is a traditional practice from Cameroon designed to make a teenage girl looks less womanly and to deter unwanted male attention, to divert the male attention. Pregnancy or rape to prevent pregnancy, early pregnancy, unwanted, that is unmarital pregnancy or rape. The practice is commonly performed by the family members, 58% by the mother. In many cases, the abuser thinks they are doing something good for the daughter, for their daughter. And by delaying the effect of the puberty, so that she can continue her education rather than getting married. Epidemiology, 9 to 15 years of the girls are mainly subjected, and the people are thinking they are doing good for their child. Breast tanning is a well kept secret between the young girl and the mother. Often father remains completely unaware. Breast tanning is practiced in 10 regions of Cameroon and has been reported in Benin, Ivory Coast, Chad, Guinea-Bissau, Kenya, Togo, Zimbabwe, Guinea-Conakry, Burkina Faso, and the Central African Republic, Chad, Nigeria, South Africa, and Zimbabwe. Indicators of breast tanning: unusual behavior of the girl in the school or college, including depression, anxiety, aggression, or withdrawn. Reluctance in the undergoing normal medical examination. There is any medical camp or there, they hide. They will not come forward. Some girls may ask for help, but may not be explicit about their problem due to embarrassment and fear. Fear of changing for physical activities due to scars showing the bandages being visible. Health consequences due to instruments which are used during the process breast, like a spoon, hot spoon, broom, stones, pestle, breast band, leaves, etc. Combined with the insufficient aftercare, the young girls are exposed to significant health risks. Breast tanning is painful, violates young girls' physical integrity. It exposes the girls to numerous health problems like cancer, abscess, itching, discharge of milk, infection, dyssymmetry of the breast, cyst, breast infections, severe fever, tissue damage, even the complete disappearance of one or both breasts. This form of mutilation not only has negative health consequences for the girls, but often proves futile when it comes deterring the teenage sexual activity occur to women and girls. And the practice not only serious damages a serious damages a girl physical integrity, but also the social and psychological well-being. I will focus this confession. I think whether it is audible or not, I don't know. It is a thing has to be or so we saw the confession. I don't know whether it is audible or not, but you have seen the captions. Very painful. Every woman undergone this is very experiencing very painful, which cannot be described in words. Sex is pleasurable, should remain pleasurable. Don't make it is miserable or painful. Thanks for your patient listening. Thank you very much.
Thank you so much, sir. Thank you for such an enlightenment talk that you have shared on such an important topic and make us understand the topic in such a better way. Thank you so much for that. We have received few questions from the participants. So, with all your due permission, I would like to put across those
Yes,
questions to you. So, the first
pleasure.
question is, what gaps exist in the research of FGM from a medical perspective, and how can healthcare professionals contribute to filling these gaps?
The law is there, and we have to refuse. If we refuse, bleeding, other complications are there. But as a WHO and UNICEF not encourages medical, legal procedures also. So we have to advise them, we have to counsel them, we have to educate them as far as possible. And we should contribute to change this attitude. If we are there in there, we have to go and address schools, colleges, and also among the public people, mother and old people, against these complications, losers, what are the things they have suffered. So we have to educate them and we should change their mind. So that is the thing we can do rather than medicalized surgical procedures. Yes, yes.
Thank you so much, sir. Thank you for answering that question. We'll move to the next question. And the next question is related to the strategies. So, what strategies can be employed to effectively communicate the health risk and consequences of FGM to affected communities?
So once again, same thing. The awareness of the consequences should be enlightened to the society at various levels, from the older people, middle people, then and there, in the villages, in the cities, and educate them. And we have to change them. And what is the real pleasure? What is the real nature? And what is the thing? And what are the things we can prevent the rape, adultery, and other things. Also, we can educate. So all these things put together, the long run may likely to change these customs in due course.
Thank you so much, sir. Thank you for answering that question. We will move to the next question, and the next question is related to potential complication during childbirth. So, what are the potential complications during childbirth associated with FGM?
I enumerated so many things. First of all, the obstetrician cannot assess the labor. She cannot perform PV, and she has to do surgery to enter in the vagina and prolonged labor. And because of that, stillbirth, complication to the mother and the baby, fetal death, neonatal death, stillbirth, low birth weight, and long-term complications of bleeding, other things. All these things can happen. Sometimes because of the strain, they may vulnerable for vesicovaginal fistula, vesicorectal fistula. All these things can happen. So there are a lot of things can happen because of this procedure. And every time she has to undergo surgery and repair, keloid. So that is also menace. It's a cruelty against these girls and women. Yes.
Thank you so much, sir. Thank you for answering that question. The last question for today's session, and the question is related to the legal and ethical obligations. So, what are the legal and ethical obligations of healthcare professionals when faced with cases of FGM?
What is the question?
The question is, what are the legal and ethical obligations of healthcare professionals when faced with cases of FGM?
So what that thing when suppose I have worked in Libya for 2 years during 1996 to 1998. My Indian colleagues, gynecologists, usually they have explained what are the difficulties they face during this women for various procedures, and such a things we must aware and we have to face it, and also we have to educate at least their further generations. So that is also ours. One thing is handling the situation. Second thing is preventing the future, protecting the future generation. So these two things are lying with our professional hands. And even in India also, I have heard many of the North Indians in Ahmedabad and cities of Gujarat hospitals and Delhi, they have come across such a problems. So these problems Unless or otherwise we are familiar, we cannot expect. What are the types of problems can occur? All these things we cannot expect. So we have to experience. So these things are there. And also, as a medical profession, in each instance, we have to educate them. At least we have to try to protect the future generation. That's my opinion. Thank you.
Thank you so much, sir. Thank you for answering that questions and all the other questions along with that, and for making our viewers understand the topic better. I would also like to thank all our viewers for their ardent participation that they have shown by staying tuned with us. And along with this, I would like to thank you, sir, for taking out your valuable time and for being here and sharing such wonderful insights and enriching experience of yours along with the PPT presentation that you have put in. Thank you so much for the efforts. And thank you for making us understand the topic better, sir. Thank you.
Thank you, Batol. But you are not come up live. That is, you are not showing your real, not open the video at all.
Uh,
Anyway, thank you very much.
yes, yes, sir. Thank you so much, sir. Thank you.